Welcome everybody. My name is Kip Renimus. I am the Chief Nursing Officer here at Midland Health. And today we are celebrating Certified Nurses Day. It's just a day early. Certified Nurses Day actually occurs on March 19th every year. But we're celebrating today, March 18th on Friday. I appreciate everyone being flexible and pivoting inside. We originally scheduled this for the O'Shaughnessy Courtyard, but with it being 48 degrees now, we decided to go ahead and move it inside to make it a little bit more comfortable. So appreciate all of you pivoting over. Before we begin today's ceremonies, I really wanted to take just a moment to recognize the 2-year anniversary of our very first COVID patient that we received here in the hospital. As you'll recall, in 2020, March 18th, our Certified Nurses Day ceremony got canceled because we got our first patient. And so from that led to the first of many cancellations, unfortunately. But now, today, we are in a much better spot. We have 3 patients in the hospital right now. So that is a great improvement. I know we've been through so much over these past 2 years. So I'd like to just thank everyone for your dedication and hard work. Everyone that has helped keep this organization running through this very challenging time. This will be something I think we know will affect this community and this organization for forever. This is going to be a long-lasting impact. So thank you all for all the hard work that you do every day for this organization. So with that, we will pivot to the Certified Nurses Day ceremony. So the very idea of a certified nurse began in 1945. The first certification for nursing began in 1945 in America. Today we have over 200 different certifications available to nurses. And we celebrate March 19th in honor of Dr. Greta Stiles, who was one of the most influential leaders in the field of nursing certification. She was one of the first to recognize the critical importance of nursing certification and was the one to help establish the first certification. So professional board certification is a voluntary designation. This is something that nurses go do above and beyond just your licensure. So when you graduate from nursing school, you have to take a test to become a nurse, and then after you've practiced, you have the ability to certify within your specialty. In doing that, certified nurses have gone above the initial licensure to validate their expertise and competency through specialty knowledge that is gained through rigorous practice. These national examinations occur throughout all the different specialties, and also they have a big impact on organizations. Certified nurses report that they have better patient care, higher quality of patient care, increased job satisfaction, increased patient satisfaction scores, and certified nurses also report higher rates of self-confidence, competence, and empowerment. And they serve as role models for their fellow nurses. Certification also shows that you care about safety, quality, and excellence in your healthcare delivery. Obtaining certification is not easy. It takes time and it takes a lot of studying. You have to schedule the tests, and many certifications require years of experience before you're even eligible to take the exam. In addition to that, there's also fees associated with exams, travel, certification preparation, and professional memberships. And lastly, this is all in addition to maintaining your license. So again, it is not an easy feat. And lastly, there's the anxiety of just the test itself. I remember the first time I took a certification exam, I had to drive to Lubbock, and I took it in a shady H&R Block. I think a lot of you know which one it is. 134th. Yeah, I don't know which one I'm talking about. I had to drive all the way there. I took the exam. I never felt so nervous in my life. I did my NCLEX just fine, but I just knew I failed, so I didn't even open my results till I got home. So I just sat there in the passenger seat staring at me the whole time. Luckily, I found out I passed when I got home. So, but it was nerve-wracking. So I always encourage, and I am so proud of every nurse on especially your initial certification. That is the hardest one. And then from there, it opens a gateway that gives you the confidence to go tackle more. And as you'll see, this afternoon, we have 250 nurses who represent over 64 different certifications, many with them having multiple certifications. So kudos to those individuals. So MMH, we value certification. We want to continue removing every barrier that we can to nursing certification. So for that, we have sponsored study groups, we have different review courses that we bring in, and of course we have generous foundation funds that we are able to provide nurses the ability to take the exam free of cost, whether you pass or fail. So we really want to remove those barriers. We also recognize it through our professional development ladder as an opportunity to advance within the clinical ladder. So with that, we want to recognize our 250 nurses today, recognizing that they have gone above and beyond improving their knowledge and skill through certification. And we thank you for your professional commitment and your commitment to your colleagues, your patients, and your professional development. We will also be awarding our second annual certification cup today. So our certification cup last year was to recognize the unit that had the most new certifications within a year. This year we have the unit with the highest number of new certifications is, drum roll, Critical Care Division. So the Critical Care Division, as you recall, they'll remind you, won last year. They had, as the reigning champions, Critical Care Division, which includes our CCU and PCU. They had 6 new certifications this year. Last year they had 8. Right now, their new total brings them to 15 individuals with 24 certifications. So that's amazing. This year, they also have the added recognition of becoming the unit with the most certified nurses and the most certifications, taking the crown from the emergency department. So kudos for So kudos to the CCU team. Keep up the great work. And I know that you both, ED and CCU, PCU, both have a certification wall. So if you have the opportunity to go down there, go check it out. But it's really a great thing to see. So with that, we will now begin our honor roll call. Today we'll also be joined with our Chief Operating Officer, Steve Bowerman, and our VP of Ancillary Services, Wes Barnes. So with that, we will go ahead and get started. So the first certifications are the Ambulatory Care Nursing Certification, and we have Keitha Parrott-Hammerman and Stephanie Wilson. So kudos. For Cancer Genetics Risk Assessment Certification, we have Jennifer Dumeyer. Cardiac Medicine Certification, we have Ashley Collins. Cardiac Rehabilitation Nursing Certification, Patricia Spicer. CVRNs are cardiovascular registered nurses. We have quite a few of those, so here we go. Amy Marshall, Amber Sanchez, Ariana Balderrama, Austin Hall, Brenda Sarapo, Sherry Porter, Dana Taylor, Diana Neptune, Jennifer Dumeyer, Jenny Del Fikes, John Haskell, Christy Foran, Laura Newbrough, Gosia, and I can never say your last name, Gosia. You know who you are, Gosia. Mara Selhammer, Ann Gibson, Miriam Molinar, Shauna Maddox, Sonia Sutton, Ginny Henley, and Xavier Torres. For our certified adult, certified pediatric sexual assault nurse examiners, our SANE nurses, we have Dana Taylor, Donna Doyle, Michelle Aubrey, and Paula Brookings. For our certified ambulatory peri-anesthesia nurses, we have Carrie Watson, Jessica Herrera, and Trina Mora. For our certified breastfeeding counselor, we have Blanca Regalado. For certified care coordination and transition management, we have Diana Ruiz. For certified case managers, we have Barbara Kobos and Jennifer French. For certified childbirth educator, we have Casey Weems. For certified diabetes care and education specialist, we have Hillary Alanis. Okay, all right. For our certified electronic fetal monitoring, we have Serena Liebarger. And for our certified emergency nurses, we have Abby Villa, Ana Rodriguez, Andrea Mendez, Kip Redimus, Brenda Campos Ilasami, I hope I got that one right, Brenda, Brittany Thorne, Brooke Carpenter, Candace Johnson, Dana Taylor, Carol Wickman, Cheyenne Ledford, Monique Wilson, Olivia Keller, Pam Castellano, Paula Brookings, Ryan Dublin, and Ginny Henry. Lots of CENs. For certified executive in nursing practice, we have Kip Redimus, Jessica Tully, and Nancy Hill. For certified extremely low birth weight certification, Kelly Cunningham. Is there a certified low birth weight one too? I've seen it. Okay. For certified healthcare simulation educator, we have Linda Sanchez. For certified healthcare technology specialist, we have Christina Ramadeo. Certified hyperbaric registered nurse, we have Brad Robinson. For certified infection control nurse, we have Val Sparks. For certified inpatient obstetrics nurse, we have quite a few. We have Elise Pine, if I'm pronouncing that right, Ashley Thompson, Cheryl Simmons, Holly Martin, Jacqueline Ogden, Jacqueline Williams, Melissa Weems, Serena Liebarger, Suzette Hamilton, Teresa Merritt, and Teresa Merritt. Okay. For our certified med-surg registered nurses, we have Adrian Ramirez, Alicia Bartholomew, Brandy McDonald, Brenda Sarapo, Byron Kuntz, Cameron Long, Krista Clifton, Diana Ruiz, Dora Gomez Leyva, Edith Chiotti, Liz Lopez, Ellie Dominguez, Erica Medina, Glenna Andrus, Jessica Tully, Jessica Villa, Juanita Alcorn, Kimberly Roman, Kristen Nall, Natalie Tarango, Nicole Arispe, Rebecca Powers, Richard Roman, Sarah Hernandez, Scola Akine, I always have a hard time with it, Scola, we love you Scola, Sharon McGowan, Sonia Sutton, Tracy Hall, and Wilson Nyamawada. And with that, I will ask Wes Martin to come up.
I'm Wes Barn, I'm Vice President of Ancillary Services, and I get to start with our certified lactation counselor, Amber Cunningham. For certified low-risk neonatal nurse, we have a few here, Amber Collier, Lacey Rodriguez, and Lindsay Jones. For certified maternal newborn nurse, Allison Meyer, Anna Cottrell, Bethany Marsh, Brittany Gilliam, Lauren Anthony, Nina Dunaway, Ronnie McDowell, and Tanya Burtenshaw. For certified neonatal intensive care unit registered nurse, short little title there, we have two, Alexandra Morin and Kimber Lovick. Certified neuroscience registered nurse, Mary Gibson. Certified nurse breast navigator, Jennifer Dillmeyer. Certified nurse educators, Carol Boswell and Diana Ruiz. We have a few for certified nurse manager and leader, Kit Redimus, Brenda Evans, Dana Taylor, Jessica Tully, and Julie Green. Certified occupational health nurse, Savita Singh. Certified patient experience professional, Nancy Hill. For certified pediatric emergency nurse, Kit Bredimus, Brooke Carpenter, Erica Mendoza, and Monique Wilson. For certified pediatric nurse, we just have one, Camille Woodard. And one for certified pediatric registered nurse, board certified, Catherine Babcock. We have several CNOR nurses, certified perioperative nurse. We have Christina Randeo, Erica Heron, Esther Ann Palka, Hillary Jones, Jordan Napoli, Karen Ward, Christy Foran, Pam Castellano, Shanice Glatz, and Tim Simicek. For certified post-anesthesia nurse, there's Carrie Watson, Jessica Herrera, Laura Newbrow, Natalie Kingston, and Trina Mora. For certified professional health quality, we have Lori Granberry, Mary Hargraves, and Bondi Salipo. Certified wound ostomy continence nurse, we have three, Diana Ruiz, Lagatha Llewellyn, and Sharon McGowan. Certified wound ostomy nurse with Tracy Hall. For critical care registered nurse, we have several, Ashlyn Duncan, Crystal Clevenger, Jennifer Scaffey, Mary Ellen Montanalo, Natalie Grace Mintz, Rosario Romo, Brian Dublin, Samantha Barber, Sonia Sutton, Trinity Doan, and Victor Miramontes. Critical care registered nurse cardiac medicine certification is Rebecca Clay. B&B certified healthcare operations professional advanced is Rebecca Powers. For fellow American College of Healthcare executives, we have Kit Brenimus and Nancy Hill. For gerontological certified registered nurse, we have Sarah Baden. Healthcare accreditation certified professional, Bondi Salipo. For international board certified lactation consultant, we have Lori Prieto. Medical surgical certified nurse, Norma Sanchez and Savita Singh. National Healthcare Disaster Professional Board Certified, we have Lindy Robinson. For Nurse Executive Advanced Board Certified, we have Brandy McDonald and Kit Brenimus. For Nurse Executive Board Certified, we have Kit Brenimus and Diana Ruiz. We have a few for Nursing Professional Development Board Certified, Jenny Delk Pikes, Jessica Tolley, Linda Sanchez, and Rebecca Powers. For Occupational Health Nurse, we have Andrea Whittingham. For Occupational Safety and Health Act, we have Keitha Parrott Hammerman. For Orthopedic Nurse Certified, we have Betsy Redman, Erin Cardona, Jimmy Carn, and Sherry Phillips. For Pediatric Nurse Board Certified, Donna Doyle. For Progressive Care Certified Nurse Adult is Brandy McDonald. For Progressive Care Certified Registered Nurse is Lindsay Hargraves. For Public Health Nurse Advanced is Diana Ruiz. Qualified Mental Health Professionals is Jessica Vanska and Michelle McClellan. Registered Nurse First Assist, Karen Ford. several for trauma certified registered nurses. We have Abby Villa, Eliza Doe Dickerson, Brenda Campos, Sami. I think you did a better job with that one. Candace Johnson, Crystal Clevenger, Erica Mendoza, Michelle Miner, Rebecca McClay, Brian Dublin, Sarah De La Cruz, and Selena Marquez. I guess we needed new batteries. I'm going to turn it over to Steve Bowerman. He'll read the last of the list.
Thank you, Wes. I demanded the short list, so I've got one page. But it's all one group of advanced practice registered nurses. Long list here. Erin Hudson, Adrian Ramirez, Anna Rodriguez, Anna Maharan, Art Resnikoff, Billy Haggerty, Brenda Campos, Brenton Ross, Charles Cadell, Corey Smith, Corey Schuler, Daniel Dominguez, David Salazar, Denise Morney, Doug Sweeney, Jan De La Rosa, Jace Clayton, Jeff Murphy, Jenny Anderson, Jenny Delk Fikes, Jeremiah Stewart, John Berry, John De La Rosa, Joshua Jones, Jovi Katada, Karen Ward, Katie Bagwell, Kayla Burnett, Kelly Yarbrough, Kyle Dunaway, Lois Daniels, Michelle Rowland, Paula Brookings, Randy Burba, Rebecca McClay, Rick Sevcik, Ronan Ola, Sherry Brooks, Susie Anderson, and Zach Ballou. Once again, congratulations to all the certified nurses that were recognized today. I'll close by saying on behalf of Russ Myers, our boards, and the entire Midland executive team, we are honored to be here today and celebrate and recognize the dedication to the nursing profession demonstrated by each and every one of you and all those that were recognized today. Nursing requires a great measure of integrity, compassion, respect, and commitment to each patient, and the perseverance to continue pushing forward. As Kit said in the opening, the past 2 years have been challenged, created challenges like we've never seen before. And our resolve in every way, and we thank you for continuing to go the extra mile in achieving the next level of commitment to yourselves, our patients, and the entire community. The support our organization, and most specifically the nursing staff, I think has received from our community over the last 2 years, truly shows why nursing continues to be recognized as the most trusted profession in any industry. As I saw in November, I think it's 20 years in a row. So congratulations on that. I'm honored to work alongside each and every one of you. You're truly leading healthcare for Greater Midland. So thank you all very much. Enjoy some lunch and cupcakes.
Everybody help yourself to some cupcakes. If you have not gotten your certified cadets, we have them up here, so everyone come get your swag.
Hey, how are you?